This is the inferior view of the skull, so there's a lot of structures are going on, so it's better to divide it. So this is the anterior part of it. So that way, in the anterior part, you can see the hard palate. This is the hard palate. And you can see that the anterior part of the hard palate is maxilla, and the posterior part of the hard palate is palatine bone. This hard palate is also making the roof of the mouth and the floor of the nasal cavity. So once again, the hard palate is making the roof of the mouth and the floor of the nasal cavity. So if you go a little bit lateral to that, then you can get the zygomatic bone. So here the maxilla is attached to the zygomatic bone. Going a little bit more posteriorly, now you can see that zygomatic bone is attached to the zygomatic process of the temporal bone. So this whole thing together is the zygomatic arch, both bones together. Okay, so medial to that you have this structure, and this bone is called the sphenoid. So this is just one bone from one side all the way to the other side. These structures that you see, these are called the pterygoid processes. So this is the medial pterygoid process, and this is the lateral, pterygoid process. Both the processes are the plural forms. And here in the middle, you have only one bone here, and that's called vomer. Okay, one bone that makes the lower part of the nasal septum, lower part of the bony nasal septum. And this is also called, this one in the green, this is called nasal concha. There's 3 of the nasal conchae, so when the time comes, I'll show you. Another structure actually to see in the sphenoid is this one, and this is called foramen ovale. Foramen ovale here, okay? This red bone that here that you see on each side, this is the temporal bone. It has a lot of different structures there. This is the zygomatic process that I told you. This one is called the styloid process. This is sharp, and this is called the mastoid process. So there's 3 different processes in the temporal bone. Also, you have some foramen here. This is called the carotid canal, and the carotid artery passes through this. Carotid artery passes through the carotid canal. And here is that jugular foramen, and jugular vein pass through that. So the jugular foramen is located between the temporal bone and the occipital bone. Okay, between these 2 bones. You also here in the middle, you see this one, this is called foramen lacerum, and this foramen is located between sphenoid, temporal, and occipital bones. So there's 3 different bones. In the intersection of these 3 bones is foramen lacerum is located. In the back, this yellow bone that you see, this is occipital bone, and this area is called foramen magnum. So the big foramen are opening, and I have different images that I will show it to you later. This is the sagittal, mid-sagittal section of the skull, mid-sagittal. So this, you can see 3 different cavities here. This area, this whole big area that you see, this is the cranial cavity, and this is where brain is located. Then is another one, this is called the nasal cavity, and the third one is the oral cavity. So there's 3 different cavities are located here. Going back to the skull, so you can see anteriorly, this is the frontal bone, and that contains the frontal sinuses. That frontal bone is separated from the parietal bone by the coronal suture, and if you go all the way posteriorly, you have the occipital bone that is separated from the parietal bone by the lambdoid suture. This is the lambdoid suture. If you look at the floor of the skull, you can see the ethmoid bone. So this is ethmoid bone going posteriorly. This is the sphenoid bone, and going posteriorly, this is the temporal bone. So temporal bone makes part of the floor of the skull and makes the lateral wall of the skull. And the occipital bone here, you have some structures here, and this one is called the hypoglossal canal, this one. And this is again, this is the foramen magnum, this area, foramen magnum. Of the nasal cavity, if you talk about the nasal cavity, so this is the nasal bone that makes the anterior part of the nasal cavity. This is the frontal bone that makes the anterior and a little bit of the superior nasal cavity. This is the ethmoid bone. This ethmoid bone together with the vomer. So these two together, that makes then the bony part of the nasal septum. Bony part of nasal septum. Nasal septum is the it's like a wall that separates the nasal cavity into the right and left. And the superior part of the nasal cavity is also made by the sphenoid bone here. So three bones are making the superior part of the nasal cavity. What about the floor of the nasal cavity? I told you before, this is the hard palate. So this is the maxilla anteriorly and the palatine bone posteriorly. Also, there is the background that you see. This is the wall of the nasal cavity, but I will come back to that later. And this is the oral cavity. So the roof of the oral cavity is made by the hard palate, and also there is a soft palate there by muscles, but we are talking about the bones here, so I will not discuss that for now. It is the lateral wall partially is made by maxilla and also partially made by the mandible. So the lower part of the oral cavity does not have a bone. There are muscles and connective tissue around here. This is the superior view. So if you cut the skull horizontally, then this is the superior view of the skull. The skull inside, you can have it three different fossae. Fossa, F-O-S-S-A, means the cavity. Again, we go back to the chapter 6. Look at those two slides. So this is the anterior cranial fossa. This is the middle cranial fossa, and this one that you see, this is the posterior nasal fossa. So there is three of them together. Okay, so in the anterior nasal fossa, you have the frontal bone here, and also you have the ethmoid. The ethmoid, you can see two different structures here. One is a horizontal structure. This is called cribriform plate, and the other one is in the midline, this one, and this is called crista galli. So crista galli is perpendicular to the cribriform plate. Posterior to that, you have the sphenoid bone. Part of the sphenoid bone is for the anterior cranial cavity, and part of it is in the middle cranial cavity. So here you can see the different wings. This is the lesser wing, and this is the greater wing. It's like a bat, lesser and greater wing. Okay. You also have different foramen here. One is the first one is called foramen rotundum, and this is the first branch of the cranial nerve 5 passes through that. The second one is called the foramen. The second branch of the cranial nerve 5 passed through that, and foramen ovale, which is the third branch of the cranial nerve 5, passed through that. The first branch of cranial nerve 5 is passing through a different structure. It is around here, but it's difficult to see it. So it is around here, very close to foramen rotundum. And you also have the foramen spinosum, and these are some blood vessels that supply the meninges, pass through that. Meninges are a type of connective tissue that wraps around the brain. So we will discuss that in chapter 14. Here is the foramen lacerum. I told you before that is an area between the three different bones, foramen lacerum, between the sphenoid, between occipital and temporal bone. And here is that auditory tube pass through that, and also part of the carotid artery pass through that, carotid artery. Here on the temporal bone, so one on each side here, and this thing that you see, this is internal acoustic meatus, and the cranial nerve 8 pass through that. And this is the jugular foramen, and you can see it's located between temporal and occipital bones. So here is the jugular vein pass through that. Also cranial nerve 9, 10, and 11 pass through jugular foramen. So lots of things. Then here is the occipital bone here, and this is the foramen magnum. Foramen magnum is an area that the brain ends and the spinal cord starts. Okay. And here that you see, this is the hypoglossal canal, which is the cranial nerve 12 pass through that, cranial nerve 12.